Good evening, man. So the scrotal scan indicates that he has bilateral epididymitis, bilateral hydrocele, which is likely infected. You also have epididymal cysts. So these are major conditions that affect the testicular environment and prevent it from being able to do its primary function of sperm production. So the epididymitis means the epididymis, which is a structure above the testis, is inflamed. And when this structure is inflamed, it affects the sperm cells because this is where the sperm cells are stored for maturation. And this also affects testicular function, including the hydrocele and the cysts. So these are major conditions. And you said he has done varicocectomy in June, and still there is no improvement, and the condition has perhaps worsened. So I pray God Almighty perfect his health and grant you pious kids. There is nothing impossible in the dictionary of God Almighty. But I just want to use this as an advice, probably just an advice for for general benefits. Conditions like varicocele, there are invasive ways to address it, like the varicocelectomy, and there are non-invasive treatment approach. Like there are a lot of natural remedies. On my page, I've shared a lot of testimonies of patients having varicocele, and we address their condition with natural modalities, herbs, and some other techniques, and we're able to get results. So even though it's not 100%, candidly, you can't, anyone that tells you that he has 100% while treating his patient, maybe he has treated just one patient, not someone that have treated thousands of patients. There's no way you can have 100. But still, before going for surgery, it is more ideal to use the non-invasive treatment procedures first, because surgery is not reversible. During the course of surgery, there are a lot of things that would happen that even you, that you own the body, when surgery is done, you're not the one doing the surgery yourself, and you won't even be conscious. So a lot of things would be done that might not be easily reversible or correctable. There are a lot of complications that can come out of surgery that it's makes it almost impossible to correct. So before going for those surgery to address those conditions, firstly try to ensure that there is no more option except the surgery. But if there are still options, even if the success rate of that option is quite low, it's more better than going ahead for surgery first, because surgery can lead to like now I have a patient maybe like 4 years or 3 years ago that told me that she had fibroid and she did the surgery, and during the course of surgery one of her fallopian tube was removed. She was now asking me that what can I do for her, like they've removed fallopian tube, will I give you, like, do you expect me to, should I give you my own? I don't even have, I'm a man. So it has been removed surgically, you get. So conditions like this are not reversible. So it's more ideal that you use non-invasive procedures before going ahead for surgery, because surgery can lead to complications that might not be correctable, that might even worsen the situation, along the line, and just make everything complicated. But to God be the glory, with what he has there now, there's still a lot of things that can be done. So the inflammation, the cyst, and the hydrocele can still be well addressed by God's grace. I'm just giving that as an advice so that next time you don't, just immediately go for surgery. Then after surgery, now be looking for natural remedies to use to address the complication of the surgery. It doesn't always work like that. So I pray God Almighty perfect his health. So give me a call tomorrow morning. Let's discuss on this.